Good afternoon, and thank you to the people of Mississippi for your diligence. I'm going to give an update this afternoon, and I'm going to be very, very brief today. Obviously, the announcements yesterday regarding the two executive orders that were signed were major news. They certainly laid out the plan going forward, effective Monday morning at 8 a.m., and that's took a lot of time and effort to get done. And I'm glad that we were able to announce that even a few days earlier than normal so that people can get prepared for that. Again, I do want to thank the people of our state. We, by and large, are seeing good compliance. It's not 100%. It needs to be 100%. And I want to continue to encourage my fellow Mississippians to continue to be vigilant, to continue to be focused, continue to stay safe, continue to think about what is not only in your own self-interest, but also what is in the self-interest of your friends, your family, and your neighbors. The fact that we're able to reopen our economy, where by Monday, every single business will have an opportunity to open, obviously with guidelines and with restrictions, does not mean that the threat of the virus is gone. In fact, we continue to see new cases each day. We continue to see new cases that are closer to 300 new cases a day rather than the 200 number where we had been for some period of time. I also want to flag a resource for all of our hospitals and long-term care facilities that is not being utilized to the full extent that it could be. We are providing PPE to these facilities, but we also have the ability to clean PPE for them and make it safe for reuse. That would significantly decrease our cost and slow the rate of PPE usage. The Mississippi Emergency Management Agency has all of the details on how to access this free N95 sterilization for healthcare facilities on their website, and we hope that all of our healthcare facilities will take advantage of this situation. Beyond that, we're also going to provide a toolkit and guidance to all of these facilities for help in procuring their own PPE as we move into the summer and into the fall. That's going to obviously be very important. It also will allow us to diversify our supply chain and help everyone become self-reliant. In the meantime, we are continuing to pump up our resources and build our reserves while at the same time pumping out resources to all 82 counties. I also want to take this opportunity to raise another flag, one that Dr. Dobbs mentioned yesterday, and that is the flag with respect to Wayne County. I know Dr. Dobbs has communicated with many of the leaders in that particular county, but this is one area that we are monitoring very closely because of the growth of the number of cases, and I do believe that very soon you will see us take action to update our list of counties that have greater restrictions, and Wayne County is certainly one of the leading counties to be included in that. Some areas where we have had additional restrictions are doing much better, and some areas where we have not are in need of much more work. We will bring an update to you most likely tomorrow with respect to the counties that stay on and the counties perhaps that can be limited a bit. All of us need to stay watchful, protect those around us. Personal responsibility and action is the only way to prevent this disease from taking more and more lives unnecessarily in Mississippi. With that, I'm going to turn it over to Dr. Dobbs.
Thank you very much, Governor. Regarding new cases, we're reporting 328 new cases today with an unfortunate 23 additional deaths. Obviously, we continue to accumulate cases and deaths, and this thing is not even remotely over, sadly. Our total case count now is 14,372 with a death count of 693. If we look at our efforts for long-term care testing for all the residents and also all the employees, we are 2/3 toward our goal of having all of those folks tested. So look forward to having an on-schedule completion by the end of this week. Fantastic work by our teams. Hospitalizations, we have seen an increase in hospital utilization. We have 449 COVID beds, 148 in ICU, and 78 on ventilators. Ventilators is stable, but we've seen increased utilization of hospital beds and intensive care units. It's a little bit of an area we need to watch closely. We know that some of the big hospitals in Jackson have limited capacity. Some of that's just because they've been busy, but some of it's because we've had steady and increasing coronavirus activity within central Mississippi. I did have a wonderful opportunity to visit with the hospital leadership and all the leaders in Wayne County this morning. I can't tell you what a committed group of leaders they are, and how attentive and interested they are in making sure they can do everything they can to limit the spread of coronavirus in their community. They had pretty low case counts until about the 18th of May, and then started having rapid increases. Anecdotally, some of the reports that are very concerning are community members who no longer were heeding the social distancing guidance and the mass gatherings, and some were quite large, and we have some evidence that some of those were points of outbreak where the many cases are likely to come. So we'll continue to work closely with Wayne County, making sure that they have the proper messages, communications, additional masks to support them, and then I'm going to have a call with the ministers and pastors in that area this afternoon, trying to make sure that everyone in that area has all the information they need to be safe. Again, just please everyone, the simple things that we can do: wear a mask, stay 6 feet away from people, and don't go to social gatherings. If we could all just do those simple things, we can do the majority of stuff that we want to do as far as daily lives, work, family, et cetera. So please just implore everyone to follow the simple steps that are going to protect the communities. Thanks, sir.
Thank you, Dr. Dobbs. At this time, I'll turn it over to Director Michelle to give his update.
Thank you, Governor. Just real quick on PPE deliveries today, delivered to 12 Tier 1 facilities in the central part of the state today. Governor, thank you for teeing up the conversation about the Battelle system. I just want to reiterate that asset we brought in was designed to extend the life of our N95 medical grade masks. As of today, we have over 100 facilities that are registering, so you're doing a great job going on and getting registered for that system. And as a reminder to everyone, your delivery, your pickup and return is included when you register to that, and it is a free service, and we'll have that until about the middle end of the month of August. So please take advantage of that system, and let's get some throughput in that. With regard to FedDeck update, really don't have anything significant to report there. I would like to remind those counties that are still awaiting action from FEMA. This new virtual environment that we've been operating since the COVID pandemic is probably going to be the wave of the future in how we do joint damage assessments. I certainly anticipate that process will become more efficient as we move along, but it has delayed some of our responses that we would normally have already heard back by now. So just be aware that we are still waiting on a number of counties to either be added to existing declarations or to be approved for new declarations. So please be patient with us, and I will continue to keep you updated with that. On our weather, you noticed yesterday that we did have some weather while we were at the press conference. We did have some straight line wind damage. Matter of fact, the MEMA was affected by that. We did lose a structure yesterday. No one was hurt, but just a constant reminder that these summer storms can certainly spurn up anywhere with straight line wind damage, and in a lot of cases can be just as damaging and deadly as tornadoes. We do anticipate a little bit more of severe weather this afternoon, much like we saw yesterday. So just continue to be aware of that. And then finally, another reminder, it is hurricane season. Even though officially it does not start to 1 June, we've already seen activity. So just ask you continue your preparations and be ready for what we anticipate to be an active season. Governor, that's all I have today, sir.
Thank you for that update. At this time, I will turn it over to you for questions. Cordelia?
Tell me about if you are anxious in any way, knowing that more folks are going to be out, but at the same time hearing from Dr. Dobbs both yesterday and today that we're starting to see more and more people who are having these social gatherings and maybe even spread within family, extended family, perhaps that people are feeling a little more lax, a little more comfortable being around larger groups of people. They're going to the store, they're out amongst people, and maybe feel even safer in a gathering amongst people that they know.
Right. Well, thank you for that question. And if the question is, am I feeling a little bit anxious? The answer today is yes, and the answer yesterday was yes, and I'm fairly certain that the answer tomorrow is going to be yes. I've been anxious since the onset of this virus and doing everything we can to educate Mississippians and make sure that we are making the best decisions to not only protect the lives of our fellow Mississippians, but also protect their livelihoods. And so what I would say to you, and one of the reasons that we are continuing to do these press briefings every single day consistently is this is the best way for us to talk to the largest number of Mississippians possible and explain in no uncertain terms that the single most important thing in protecting Mississippi from this virus is for individuals to exhibit personal responsibility, for individuals to wear masks, for individuals to ensure that they are socially distancing. And if you are attending some of these gatherings, you're making a personal decision to attend them. There's some things that government just can't stop. And the fact is that we have laid out guidelines. We have tried to exhibit through numerous executive orders. I feel like I probably have signed more executive orders in the last 2 weeks than the last 2 Republican governors combined. This is not exactly what we envisioned when I qualified to run for governor in January of 2019. We don't really fundamentally believe that government through executive orders can do a whole lot to make the lives of people better, but we've been trying to make sure that we alert and alarm our fellow Mississippians to the risk that exists. And that's, I can say that in no uncertain terms. If you go to a social gathering that has 100 or 200 or 300 people at it, the risks are going to be higher than if you choose personally to stay in your home. Now, I don't believe that I, as governor, have the ability to order people to stay in their homes for months and months and months on end, but you as an individual certainly have the right and to make good decisions and to limit the amount of risk that you put yourself under. And when you are limiting the risk that you put yourself under, obviously you're also limiting the risk to those individuals that you care about, whether it's those who are in more vulnerable populations. If you feel, if you have a mom that lives with you or a grandmom that lives with you, we know that this virus is transmissible even amongst people who are asymptomatic. And so if you may not feel bad, that doesn't guarantee that you do not have the virus. And so, again, we've tried to plead with our fellow Mississippians. We've tried to open up all of our businesses in a way that was safe and responsible, or as safe as is possible. But now we need Mississippians to step up and make good decisions, to wear masks in public, to stay 6 feet apart. Try to stay 8 feet apart if you can. It's the little things that we can do to minimize and mitigate risk is what's going to save us in the long run. Yes, sir.
Dr. Dobbs, hospitalization jumped 79 more people hospitalized. Does that keep you up at night? 1. 2, what does that mean as far as the hospital space that we have? Just kind of put it in perspective about our capacity.
And yeah, so we watch this very closely, and certainly we've seen an increase. Some of that increase is a reporting blip because we had some non-reporting hospitals over the weekend. That does happen from time to time, but our hospitalization numbers are up, and we're hearing reports from different hospitals that they're having more cases. And once you get a coronavirus case in the hospital, this is not usually a 2 to 3 day admission. This can be long, and sometimes it can be weeks and weeks depending on how sick they are. So it's something we watch very closely. Statewide, we have good capacity. We also have crisis capacity that we can use if we have to, and we certainly haven't tapped into that, don't want to have to tap into that. So it is something that we monitor very, very closely, but we have capacity to deal with it right now. Regionally, it's different. Certain places have more stress than others, and so that's a concern. I know when we're talking about Wayne County, they had a significant increase in the number of patients over the past couple of weeks, mirroring the cases we've seen, and then also ventilator usage. They maxed out their ventilator capacity, essentially. So it's something we have to be conscientious of. Every community is one wild weekend from falling off the cliff. I don't care how great you've been, and if you're in a northern county and everything's great and say, okay, we can go back to normal, you can't go back to normal. What you've been doing has been working, and keep it up. Congratulations. Don't let up your guard, because one huge party and you get 20, 30, 50 infections from one gathering, because we know people can spread it to a whole bunch of people when you grab them together, kind of like the funeral situation we've got going on, and we'll have more of those. Please, if your county's doing great, keep it up. Don't let your guard down, because it's going to not only going to cause illness, but it's going to stress the health system, and people are going to get sick and die.
Renee?
Dave Elliott from the Access question.
You got me, Governor?
I hear you.
Some pretty interesting numbers out today. The Gaming Commission says Memorial Day weekend casinos grossed $33.9 million, up $5 million from the same weekend last year. Hotel Lodging Association says on the coast, Friday and Saturday, occupancy about 82.7%. It was single digits in March and April. Good news for the entire tourism sector. What are your thoughts on how that is encouraging and important to the economic recovery?
Well, thank you for that question, Dave. And I will tell you that I talked to a restaurateur, a mutual friend of ours, and they had a very strong weekend over the weekend on the Mississippi Gulf Coast, Memorial Day as well. And so I think what we know is there's a lot of pent-up demand out there. People want to go to nice restaurants and eat. People want to be able to go to casinos, and that is true of those who have been in their homes for a long period of time, or those who have been getting up and going to work and then driving straight back home. And so there's a lot of desire and demand for entertainment opportunities. And I'm encouraged by that. I'm really encouraged by that. That's going to get more people back to work. But I also know that makes it even more important that as more and more businesses reopen, that we do so in a safe way. That because casinos who had a very good weekend, well, by definition, that means they had a lot of people in their facilities. And so it's critically important that they follow those guidelines, and I have full confidence that those large and small businesses alike are doing just that. But, I'll tell you, Dave, you look at 2019. 2019 was one of our best years from a tourism standpoint in many, many, many years. We've had fantastic weather, and we had a great weekend of weather for Memorial Day weekend. And I firmly believe that 2020 was set up to be the best year Mississippi Gulf Coast tourism has had ever. And I hope that as we move into the summer, as more and more people get back to work and therefore get a little bit more extra change in their pocket, that they're able to spend it, because tourism is a critically important piece of Mississippi's overall economy. I don't have to say that to you, because on the Gulf Coast you certainly know that. But tourism is incredibly important in every community throughout our state, and I'm hopeful that as we continue to reopen, that our folks will continue to get out, but do so in a safe, responsible way.
Tate Reeves from the Post has a question.
Dr. Dobbs, in reference to the funeral in northern Mississippi, have y'all been able to pull any data from that yet, as far as how many have been hospitalized, on ventilators, and God forbid any deaths related to that particular event?
We're still working on it. There was a press release that should be released now, or has been, or very shortly, that will give some details about it. Because we're trying to get a notification out to attendees who are ill, so we can backtrack it. So kind of like a hepatitis A outbreak, we need to figure out who's been there. So we're still collecting information. I'm not aware of anyone who's died or required mechanical ventilation, but we're still gathering information. We're going to really expand our investigation on that, because there could be a lot of cases come out of that.
Dr. Dobbs, Madison County, we talked about it, I think, a couple of weeks ago, but from the perspective of rate per capita, it now has a 57% higher case rate than Hinds County even. Do we know what's happening there? Are there social gatherings that we're hearing about anecdotally? What do we believe is the reason?
It's kind of curious. Every county and has its own sort of personality, so when you really look into it. So the driver for the number of cases in Madison County is Canton area. Canton has the vast majority of cases. And I think I did write down, I think 9% are poultry-related workers, and then 18% are long-term care. A lot of those long-term care happened recently, and a couple of weeks ago, we had a confluence of two testing events, and also we did some mass testing at nursing homes, and so we had kind of a big jump. But there are a lot of cases there. Some of the recent sort of stuff is artifactual, but if we look at the number of cases week over week for Madison County overall, it's been relatively stable, at least in recent days. But still, a lot going on there. I strongly encourage people across the state, but especially in Canton area, to be very careful for social distancing, masks, and all the things we know that are going to work.
The only thing that I would add there is it does make me happy that more and more questions are being directed to specific counties. Because that is the phase that we find ourselves in our response. We know that we don't have to treat the Canton area and Madison County exactly the same as we treat Tishomingo County in the far northeast. And so, the easy thing for us as policymakers would be to, okay, we're going to have one blanket statewide order, and this is what it is, and we can sign one document and it's over. But that's not the best thing long term for the people of Mississippi. We've got to be smart. We got to put in the time, put in the effort, be willing to work overtime so that we can, if necessary, add a Wayne County in the near future. Maybe even recognize that there are 2 or 3 or 4 counties that are currently on the list that have really stepped up and their numbers have declined considerably. So maybe we can take them off the list of those counties that have additional restrictions.
Patrick McGee with Sun Herald has a question. Patrick?
Yes, Dr. Dobbs. Noticed today for the first time the 7-day average creeped over 300. Would you kind of credit that to an increase in testing in long-term care facilities or increase in testing overall? What's the best way to attribute that?
Certainly, I think some of it is increased testing in the nursing home, and you can't test 27,000 people in 2 weeks. When you consider we've tested about 160,000 people altogether. So there is going to be an increase from that. But I think it also definitely speaks to ongoing transmission. I mean, a lot of it's not just because we've tested more people, it's because it's still out there. And, certainly some of the areas have higher rates of transmission than others. So it's a combination of continued stable transmission that requires our attention, and then additional testing that we're doing in this aggressive push.
Thank you, Dr. Dobbs. I just would like to say, Patrick, I think you're doing a great job covering the coronavirus, but I look forward to the day when you can get back to sports, because that means I can get back watching sports again.
Kobe Vance with MPB has a question. Kobe?
Yes, when it comes to mental health again, it's been a concern that people are stuck in their homes, or they're working in high-risk areas, or they're unemployed amongst the pandemic. So what are y'all hearing as far as mental health goes in the state, and what are y'all concerned about for Mississippians' mental health?
And certainly we're very concerned. There are resources that are available, and we talked about that a little bit yesterday, where people can access in general, but one of the places that we're having more conversations are in long-term care settings, not only for the residents but their family, because it's been very distressing on those people, on those folks. So we'll continue to have we're starting conversations about how do we find a path forward for people to see their loved ones in a safe way, because right now we're still in the heat of people dying in long-term care outbreaks. So whatever we decide has to be very thoughtful and evidence-based. So it certainly is very much in our minds.
Yeah, there's no doubt. Mental health is a topic that I have been trying to address since the beginning of this. We knew, I can remember the very early days, maybe even the first week or two, talking about how there was a particular week in Tennessee in which there were more deaths from suicides than there were deaths from COVID-19. And because it is a very stressful time for everyone, for all of us. It's stressful for those individuals. It's now nearly 300,000 that have filed for unemployment insurance over the last 10 to 11 weeks. It's very stressful for just individuals who haven't been able to get out of their home. They've been going to work and coming home, and we are a group of people in Mississippi that like to enjoy ourselves. We like to get out and go to ball games. We like to get out and go to restaurants. We like to get out and go to the beach, and maybe even some other places as well. And so it's been stressful on them. It's been stressful on those individuals that are in the healthcare space. I mean, obviously, many of them are working overtime hours, working and being on the front lines of dealing with patients with COVID-19. It's hard work. I mean, it is really, really, really hard work. And so there's stress related from those who have jobs and the very difficult challenges that they have faced over a long period of time. And then, of course, Dr. Dobbs mentioned it, and it's something that we're really trying to think through because I know it's very, very hard for not only the residents in long-term care facilities, but their families who want to see grandma. You know, I mean, that's something that we as Mississippians do. We like to go and see our family and see our parents and tell them we love them. And we want to, I mean, it's one thing to text them or call them and tell them we love them, but we want to see them face to face and tell them we love them. And so that's certainly something that we're going to continue to have conversations about. How do we do this? We've got to be able to do that. We can't go a year or a year and a half without our Mississippians being able to at least look in their grandma's face, even if it's from 8 feet away outside or something along those lines, and just say, hey, I love you. So.
Joey Barnes with WCBI has a question.
Governor, I kind of have a multi-part question here because I've had several questions come from daycare workers and owners of daycares. And my question is, do they fall under the gatherings of social distancing of 20 people or less indoors? Or what is the limitations of, can they have a full class? Can they run at 50% capacity? Or has there been any sort of official ruling on that maybe I've missed?
Well, thank you for that question. The daycare facilities were actually deemed essential businesses from the beginning. Again, I've admitted many times from this podium that I wish I had not named any businesses essential versus non-essential, but that's a prime example of one of the reasons that we chose to go down that path is because we did not want to allow overzealous local governments to shut down daycare facilities, knowing that there are certainly essential workers in the healthcare space and in the grocery store business and lots of other places where they've got to have somewhere for their kids to be able to go while they go to work. And so daycares can open. They can open at full capacity, but we want to stress to those daycares how important it is that you recognize where we find ourselves. You recognize that we are in a very challenging environment, and so to the absolute extent possible, giving these young people the opportunity to space out, to spread out, to make sure that your workers are wearing masks. Sort of the very same things that we're asking individuals to do in public, we're asking those daycare operators to do in their business, although they're not limited to that number 20, because that's not really a social gathering. It is work, and it is a necessary business that could be open. What we've seen in practice, just to be fair, is for many of these daycare operators that have maintained openings, that they are most of them are open at much less capacity than normal, but that's because individuals are making that decision. Individuals are working from home. Individuals are making other decisions because they're concerned or they're scared, and things such as that. And that's certainly the American way. So.
Dave with WLX has another question.
Governor, regarding the $300 million small business assistance measures, yesterday you talked about the $60 million more instant payment plan. As for the $240 million grant program through the Mississippi Development Authority, I've heard an outside group is being brought in to help administer the grants. That firm could be announced tomorrow. What are you doing to make sure money quickly and efficiently will get into the hands of people who really need help immediately?
Yes, thank you for that question, Dave. And you know, that's something that we think is extremely important. We've been preaching off that hymn book for the last 3 to 4 weeks. I had a meeting yesterday afternoon with our team. Suffice it to say, I was very clear with them how important it is. We do have to bring in an outside group to help administer the program. We do not have the capability internally to not only have an application process, but to ensure that those applications meet the federal guidelines as described by the United States Department of Treasury, and so we are going to get that done very soon. And once we get that process completed, I am very hopeful that we can then begin the application process again as early as next week. I think this is critically important, and we are working diligently around the clock to make that happen.
Kobe with MPB has another question.
Yes, for enforcement of these regulations that we have, just like, wearing masks in places and things like that, how is that being patrolled? Are law enforcement getting involved in that, or is it just in good faith of businesses to follow through on those regulations or guidelines?
I think the way I would answer that question is yes and yes. Certainly, local law enforcement has the ability to enforce all state laws, and these executive orders do, in fact, carry the weight of state law. And so we've got, for instance, I know, because I talk to law enforcement all the time, I know that you've got sheriffs on the Mississippi Gulf Coast who are patrolling the beaches and making sure that if they see a group gathered up much larger than is allowed under the order, that they break them up, they send them home. Same can be said for some parties that are being had in counties where they shouldn't be being had. And so local law enforcement can do it, but the best enforcement of any statute that we have is individuals in our state enforcing it themselves. And so that's the reason that we have been pleading with our fellow Mississippians to be smart and to do the right thing. Yes, sir.
Dr. Dobbs, the press release you spoke about came out earlier that identified possibly 100 people. Should those 100 people get tested if they have not been tested? What steps should they take?
I know we're still in the investigation phase, but typically the process would be anyone who has had significant exposure within 6 foot proximity for 10 minutes or more would need to be placed on quarantine orders, and certainly that's something that we'll be looking at. We'll be reporting those that are out of state, people who traveled out of state, to make sure that their local health departments can do it. Certainly, testing would not be is an appropriate pathway to follow, and it's something that we hope to do routinely in the near future as we build our own internal capacity for everyone who's a contact. But if people need to be quarantined, even if you test them, they have to be quarantined for 14 days, because if I test someone today, they may get positive tomorrow. So that time period is the most important thing. Even if they test negative, they need to stay in quarantine for the full 14 days in case they become positive later on.
The one thing I would just like to mention, and I don't have all of the details yet, but I have been very clear over the last number of weeks how important the role has been that the Mississippi National Guard has played in our response. They have done tremendous work, everything from the Department of Health helping on testing to the distribution of assets for MEMA. They have been incredible. We want to thank them for their efforts. I did have the opportunity to speak with a number of people in the White House, including soon the Secretary of Defense under the Trump administration. President Trump did indicate today that Title 32 funding would be extended. I had previously announced that it would be extended until June 24th, which, if you take the approach that those men and women would need a 2-week transition period of self-isolating after they were done, then we could have run out of our National Guard resources being paid by the federal government as early as June the 10th, which is barely 2 weeks from now. The president did indicate today that he was going to extend that perhaps even out until the middle of August. That is very, very good news for the people of Mississippi. I want to personally thank President Trump and his team for their leadership on Title 32 funding. It is certainly helpful to us, it's helpful to the state of Mississippi, and it is critically important that occurs, because those are resources that we don't have to utilize state assets. We can utilize federal assets to pay for that, and that just frees up other monies in our state opportunity to do other things with. I do want to point out that a couple of areas that are very important to us as we move forward in working with the legislature is we have to ensure that we have adequate resources to not only pay for the PPE that we have already purchased and sent out to our Tier 1 and our healthcare facilities, but also that we have adequate resources going forward so that if and when we have an additional surge in the fall, that we have resources immediately available so that we do not find ourselves in the same position in August, September, and October as we found ourselves in early March when we were scrambling to find PPE, and that's masks, that's gowns, that's face shields. We've got to build up our stockpile, and that's critically important. And the other thing I just mentioned is as we look at the unemployment trust fund, we know that there's hundreds of millions of dollars that is going to be utilized to be spent for those individuals who are on unemployment insurance through no fault of their own. I want you to know that I believe it's critically important that we do replenish that trust fund. That is a use of the CARES Act that I think we definitely have to do. And the reason for that is if you don't replenish the trust fund, then taxes on small businesses will automatically go up. And this is the absolute worst time as these small businesses are struggling to raise taxes on small business owners. And so we're going to work with our team in the across the street in the legislature and make sure that they are committed to doing those two things. We think it's real important. Most of the folks in the state capitol, I'm sure, believe that those are the two of the most important things we can do with CARES Act funds, and we're going to certainly work to get that done. So, seeing no other questions, I want to thank everyone for being here today. It's already Thursday afternoon. Y'all be careful, be safe, and God bless.